Hello, everyone. My name's Naa Wilson-Kumi. Thank you so much for inviting me to talk about my profession today. I am a certified registered nurse anesthetist, also known as a CRNA. I've been practicing for almost 18 years in this field. I currently work at St. Mary's Hospital in Waterbury, as well as the Naugatuck Valley Surgical Center. So what is a CRNA, you ask? Well, we are advanced practice registered nurses who administer anesthesia for surgery or other medical procedures in and out of the operating room. CRNAs are independent, licensed practitioners and can practice with or without supervision or collaboration with an anesthesiologist who is a doctor specializing in anesthesia. CRNAs account for approximately half of the anesthesia providers in the US. And we are the main providers of anesthesia in rural areas, medically underserved communities, and the US military. And we are leaders in our field. How did I choose this career? Well, when I was younger, I wanted to be a psychologist, actually, because I'm interested in caring for people and knowing what and why they do and behave in certain ways. I was raised in Ghana, West Africa, and that's where I did my high school education. But then I moved to the US to join my mother and stepdad, and I was encouraged to go into the nursing profession. While in nursing school, I had a surgical procedure and my anesthesia provider was an African-American nurse anesthetist. I knew that I wanted an advanced degree after my initial bachelor's degree. And when she asked me what I wanted to do after school, I told her that I wanted to be a nurse practitioner. But she said to me, "No, you don't. You want to be a nurse anesthetist. There aren't enough African-Americans in this field, and you are needed." That was back in 1994, and I'd never even heard of a nurse anesthetist before. I started researching it, and I decided that was what I wanted to do. Well, for the education needed, it takes about 7 to 8 years to be a CRNA. First of all, you need to earn a Bachelor of Science degree, which takes an average of about 4 years. And then you take an exam to be a board certified registered nurse. After that, you have to work as an acute care nurse in either an intensive care unit, a cardiac unit, or an emergency room for about a year or more. The more experience you have, the better. But different anesthesia schools have different requirements. Personally, I practiced for 4 years as an ICU nurse before applying into anesthesia school. Nurse anesthesia programs are competitive and academically rigorous. And some of the prerequisites needed include chemistry, anatomy and physiology, microbiology, statistics, a strong GPA, typically 3.2 or higher, and the GRE exam. Currently, a master's degree program is what is required. Most of the anesthesia schools are master's degree programs, but the American Association of Nurse Anesthetists is mandating that a change is needed to a doctoral program starting in January 2022. The master's or doctoral coursework will prepare you to administer anesthesia and care for adults, pediatrics, as well as neonates prior to surgery, intraoperatively, and postoperatively. After the program, you have to apply and take a CRNA certification exam, and then you can become a CRNA. Some of the courses that you need to take or should take while you're in high school, if you're interested in going to CRNA school, will be some advanced math courses, AP biochemistry, science courses as well. How does a typical day for me look like? Well, I get into work around 6:45 a.m. I change from my scrubs from my clothes, street clothes into scrubs and tennis shoes or work shoes. I have to cover my head. I need a head covering because the operating room is a sterile environment. I also have to wear a mask. I check my schedule to confirm what room I'm in and what procedures I'm doing, what kind of cases I'm doing for that day. Then I go in to check and pick up my narcotics or medications that I will need for the particular cases that I'm doing that day. Then I go into the operating room. I check my anesthesia machine, which is how I administer most of my anesthetics. And this has a checklist that we use to check the anesthesia machine to make sure that it's optimal. Then I set up my room, which involves setting up my machine, section, which is just in case a patient a patient's mouth needs to be cleaned, or if they are vomiting or anything is going on in their oral cavity, I can section that out. I set up my monitors, which is the EKG, blood pressure cuff, pulse oximeter to monitor the vital signs. And then I also set up airway equipment to help them optimally breathe. I set up an IV, and then I set up the medications and the drugs that I need to administer to patients that day. After that, I'll go in to look at the patient's medical history on the computer. I look at their allergies, their height and weight, and anything that any procedures that they've done previously to help me be able to get myself ready for them to prepare for the anesthetic. Then I meet with the anesthesiologist. If I'm working with the anesthesiologist that day, I meet with them to collaborate on the care of the patients. Subsequently, I go in and meet the patients personally. I do a pre-op assessment, which is listening to them, listening to their heart and lungs, assessing them, finding out what they've had to eat that day. Usually, patients don't eat before surgery. We keep them NPO, we call it, nothing by mouth, before midnight, after midnight the day before. So then I discuss with the patient what is the best anesthetic plan for them. I answer their questions. And then we get the patient to sign a consent to give us permission to give them anesthesia in the operating room. When the operating room team is ready, that is the RNs and the scrubs, the surgery, the surgeons are ready, we take the patient back into the operating room. And then we hook them up to our monitors. We give them some oxygen. I start sedating them, that is giving them medicine through their IV to help them go off to sleep. Then once they are asleep, if the patient needs to be intubated, which is putting a tube in their mouth, in their throat, I will do that. If the patient just needs oxygen mask or nasal cannula in their nose, I will do that too. And then I give them anesthetics through their IV, or they get some anesthetic gases and oxygen to keep them throughout the procedure asleep and comfortable, and keep them warm and monitor them every minute, every beat until the procedure is over. When the procedure is over, I wake them up, then make sure that they don't have any nausea, make sure that they have minimal or no pain at all. And then we bring them to the recovery room with oxygen. In the recovery room, typically we give a report of what has happened in the operating room to the post-op anesthesia nurse, that's the PACU nurse. And then we tell them any events that happened or how to take care of the patient postoperatively, the patient's needs. So that's essentially what I do for my initial patients. And then I essentially, after giving the report, I go back into my room, clean up my operating room, and set up the room again, just like we started off for the next patient. A typical day, I may have from anywhere from 3 patients to maybe 10, 11 cases a day, depending on if I'm doing what cases I'm doing. I may just be doing some orthopedic cases, or I may be doing GI cases, which I may have a lot of cases that day. I do anything from orthopedic, plastic surgery, eye cases, GI cases. We do ear, nose, and throat. We do anything. If I'm in the hospital, I may even do a C-section, or I may be in the MRI suite or CT scan. Sometimes they call us to the ER to help with intubations. And sometimes we have to go to the floor in the ICU to intubate a patient, which is to help them with their airway, to help them breathe. There was a question about the skills needed as a nurse anesthetist. Well, obviously, the knowledge of anesthesia, medications, and side effects are important. I also think compassion and empathy is also an important skill. Critical thinking, definitely. Communication, teamwork, and time management are also important aspects to this, to have in this field. The outlook for my career. The Bureau of Labor Statistics has shown that for advanced practice nurses, the field is supposed to grow around 30% by 2024. In terms of salaries, it varies by geographical area, the type of practice that you're in, and the years that you've been practicing. But the median annual salary is about $160,000, depending on if you're practicing in a hospital or other settings. But nurse anesthetists practice in hospitals, we practice in day surgery, we do delivery rooms, doctor's offices, plastic surgery offices, dentists, and we are also sole providers in rural areas, like I stated earlier. For more information, you can contact the American Association of Nurse Anesthetists, the website, which is aana.com. Finally, a few words of advice. Whatever career or job opportunity you want to go into, I think it's imperative to be hardworking and resilient. I think teamwork and collaboration are also key for success. Kindness, compassion, and empathy are attributes that are important in any aspects of life, because everybody wants to feel cared for and understood, whether in the corporate world, in healthcare, or in a blue-collar environment. I would advise you to seek to make a difference in people's lives, if only by showing that you care about them. So once again, thanks so much for this opportunity. I wish you the very best. Take good care and be safe. Bye.